Vector-borne diseases continue to pose a significant public health challenge in Saint Lucia. Factors such as socio-economic vulnerabilities, limited public awareness, and lack of coordinated sectoral engagement contribute to the persistence of these diseases. While individual ministries have undertaken efforts, a unified, culturally relevant, and community-driven approach remains essential. In response, the Caribbean Public Health Agency CARPHA initiated the Vector-Borne Disease Public Education Campaign on Tuesday, April 29th in Saint Lucia. The campaign, titled Mosquito No More, is supported by CARPHA and funded by the European Union. Training sessions continued on Wednesday, April 30th, engaging representatives from 4 major sectors: health, education, church and religion, and tourism. Public Education Campaign Lead Consultant Dr. Willie Dunbar shared insights into the campaign's origins.
This campaign, originally it came into our mind based on a study that was conducted in 2018 in Saint Lucia to know about knowledge, attitude, and practice related to vector-borne diseases in the populations. So after the study, CARPHA came up with the European Union, and now we are working with Saint Lucia in establishing and developing and also implementing a campaign, a public education campaign. And this is really original for us because we are including every sectors.
CARPHA Surveillance, Disease Prevention and Control Acting Director Dr. Horace Cox highlighted the value of partnerships.
The theme for this campaign is Mosquito No More because we recognize that mosquito vectors cause a real problem on the ground. And it is only with community support and participation that we can achieve this common goal of getting rid or limiting these vectors and therefore reducing the transmission of mosquito-borne diseases.
Mosquitoes are ectotherms, right? So they really rely on their environment, including temperature, precipitation, relative humidity. So these are things that we have to take into context when we're planning these types of health interventions. One of the best methods that we have found is using a transdisciplinary science approach. And what that really means is that we're including all different kinds of sector in this response. So we have sectors, as my colleague stated, in tourism, we have sectors in religious affairs, we have sectors in health, in education. We have developed this campaign in collaboration with students. We did interviews with 5-year-olds, 6-year-olds, 7-year-olds, all the way up to 17-year-olds, with principals, with teachers, to really develop curriculum that was hands-on and interactive.
This campaign represents a strategic and timely effort to address vector-borne diseases through education, empowerment, and community engagement. By involving schools, churches, communities, and the tourism sector, and employing bilingual, digital, and relatable tools, the VBD-PEC aims to foster sustained behavioral change where it is needed most. With ongoing stakeholder collaboration and monitoring, this initiative not only aims to protect public health, but also to serve as a model for regional impact across the Caribbean. Shane Stephen, NBC Prime.